Oh, hi, it's me again. So you just had your tooth filled. So a couple things that you need to know about. If you're still numb, try not to bite yourself. Don't bite your cheek, don't bite your lip, don't bite your tongue. If you bite it when you're frozen, you won't feel it too bad, but when it wakes up, it's gonna hurt. So try not to do that. So it is normal to have some pain or discomfort after any dental procedure, and that's no different than a filling. So after a filling's done, of course, where the injections went in, if you had injections, they might be a little bit sore. If you bit yourself, of course, that's going to be sore. Your jaw might be a little bit sore depending on how long you were open for. So expect some discomfort from those aspects of being in a dental office. The other things that might hurt is the tooth itself. You might get a little throbby, you might have a little achy. Everyone's different after a dental filling. Obviously, the deeper the cavity, the more likely you're going to experience some form of discomfort in the tooth. So normal sensation after a filling appointment is some form of pain or discomfort in and around the 3 or 4 range out of 10 or less. If you have that and either by itself or to temperature, and every day or as time passes you're getting better and better, you're probably fine. That's within normal. If you have severe pain, on the other hand, pain that's like a 7, 8, 9, or 10 out of 10 for pain, that's not normal. Okay, so if you have that, you better give us a call. We find that Advil does work a little bit better for dental pain because it's an anti-inflammatory. Advil will be better if you can take it. If you can't, Tylenol works, just not as well. If you remember, at the end of the appointment, we spent a little time adjusting your bite to make sure that all your teeth came together. We had you bite on the blue paper, had you grind left and right, side to side, and really clench really hard on that thing because we wanted to see if there's any part of that tooth that was hitting more than it should. Now the problem with that is sometimes when you're numb, you don't bite the same way as you normally do when you're not numb. So if there's any spot on your tooth that's hitting a little bit harder than it should, give us a call. If your tooth is a little bit high and you're biting on it too much, it'd be like stubbing your toe and you keep kicking it, and you keep kicking it, and you keep kicking it. It's going to get really bruised. And the other thing is when you're sleeping, you often will be clenching on that tooth. So it's taking that really sore toe, digging it right into the ground. So the minute you realize something's wrong with your bite, please give us a call so we can adjust the area to alleviate any problems with your bite. The other area that might be sore is the gum area. So if we're working very close to the gums, if we're working near the roots of the teeth or in between the teeth, sometimes the gums can be a little sore. Usually Advil will take care of that as well as warm salt water. Now sometimes the gum had grown into your tooth, and if that was the situation, we might have used a dental laser to remove that tissue. In that case, yes, your gums are definitely going to be sore after the appointment. So again, Advil, warm salt water. Once the numbing comes out, you should be able to eat right away. The fillings are as hard as they're going to be when you leave the office. If we did bonding for your teeth for sensitivity issues, you had a root exposed and you had to cover that root, and if we had to numb you for that procedure, it's really impossible for us to know if we took care of all your sensitivity. We can seal everything we can see, but there might be some micro areas we cannot see. So if you have any lingering sensitivity to temperature, please give us a call so we can get that resealed a bit more when you're not numb, and we can take care of that for you more accurately. If you are a known clencher or grinder, it's very important that you address that. Grinding and clenching will break down not only your teeth, but any restorations that are currently in your mouth. If you're not treating the grinding and clenching, you're literally going to be grinding away all that work. Remember, having a filling does not mean that it's invulnerable or impenetrable to decay. You got to take care of this thing. If you're not brushing or flossing, that filling is not going to last very long. So just because you had a new filling done doesn't mean it won't get cavities again. So lastly, if you had a very large filling, and I mean a filling that is more than 60% of the chewing part of your tooth, it's highly recommended that you get something called a dental crown on there, because your tooth being mostly filling is a lot more prone to fracturing and breaking. We really hope you had a positive filling appointment. We try our best to work diligently and efficiently to provide you the best filling appointment that we can provide. If you had a pleasurable experience at our office, we would love to hear about it. We love hearing from our happy patients, and my staff really enjoy hearing that they're doing a good job. We would be absolutely honored if you left us a 5-star review on our review page. Of course, if you have any friends or family who you think we can help, we'd be honored to serve them as well. If you were not completely satisfied with your appointment, please give us a call and let us know how we can make your next appointment a 5-star visit. Thank you again for your trust in our services. We hope to see you very soon. I'm Dr. Jesse Chai. We'd love to see you smile.